Hello, my name's Rochelle. I will be talking to you today about allied health assistants. I'll be handing out some flyers to help assist with the following of my speech. There is also an interpreter on hand, so please let me know if there are any problems understanding and feel free to stop me at any time with any questions. An allied health assistant works under the supervision and delegation of an allied health professional to assist with therapeutic and program-related activities. The level of supervision the allied health professional provides is dependent on the experience, skills and qualifications of the assistant and the service context. While allied health assistants work within defined parameters, the role is often flexible, involving a mix of direct patient care and indirect support. The mix of duties is determined by the model of care, the needs of the professional delegating, and the types of services delivered by the allied health team. Allied health professionals have responsibility for all diagnosis and clinical decisions regarding client care, including developing care plans. It is never okay to delegate these responsibilities to an allied health assistant. The roles and responsibilities of an allied health assistant may include contributing to the provision of an effective allied health service, liaise effectively with other allied health staff, form appropriate therapeutic relationships with clients, undertake group and individual client programs devised by the health professional, document reports as directed, regularly report details of client contacts to the employing allied health professional, participate in staff meetings, undertake such administrative housekeeping duties, participate in in-service education as required, assist with planning and implementation of patient-client programs, prepare and maintain the therapy environment and equipment, ensuring that optimum physical conditions prevail, such as lighting, temperature, seating, space, safety, cleanliness, arrange for repairs and replacement of machinery and equipment as instructed by the allied health professional, and counsel educate clients within the scope of the client intervention program defined by the professional. Some knowledge required by the allied health assistant. The employing allied health professional will specify the minimum academic and personal qualifications required for the particular position, including acceptable recognised formal training programs. Training should include guidelines for all documentation carried out by the allied health assistant, and the guidelines should identify content required, placement of documentation, requirements for countersigning and procedures for review by the allied health professional, hazard identification, risk assessment and reporting hazards such as manual handling, fire safety, CPR, first aid, infection control. An allied health assistant should also have knowledge on ethical principles such as respect for the rights and dignity of the individual, confidentiality, standard of care, limit of competence, legal responsibilities, loyalty to the employer, and standards of professional behaviour. The limitations of an allied health assistant. The allied health assistant must not substitute for an allied health professional in the areas of assessment, diagnosis, prescribing medication, program planning, program evaluation of the client and family education. An allied health assistant is not allowed to prescribe medication to a client, nor are they qualified to put forward a diagnosis to the client either. An allied health assistant works under the allied health professional. They do not have the same expertise or qualifications, so the allied health assistant is to carry out plans and directions given from the allied health professional. Some of the benefits. The support workforce plays a vital and increasing role in the provision of high quality allied health services. The workforce optimises service provision by contributing to patient care, increasing capacity and improving service continuity. Having an allied health assistant benefits the department in a way that it allows more time for quality care for the patient or client. The allied health professional has more time to do tasks they are qualified to do, like constructing valuable client programs, instead of spending that time, for example, on supplies or equipment maintenance. It is highly beneficial in terms of time delegation. And that's all for today. Thank you.